Thank you and good afternoon, everybody, and welcome to our education session on perspectives of Cantonese-speaking older immigrants in Toronto on elder abuse risk factors. It's my pleasure to introduce our distinguished speakers for today. Guida is an associate professor in the sociology department and a member of the graduate program at York University. As a faculty associate at York University Center for Feminist Research and the Center for Asian Research, her research intersects migration and immigration and transnationalism, families, gender and work, and racism and racialization in the context of neoliberalism and global economic restructuring. She is also the co-investigator of two other funded projects on elder abuse and on the inequality and intergenerational relationships among newcomer households, and the collaborator of the two partnership grants with the SSHRC programs. Ernest Leung is an MA candidate at the York and Toronto Metropolitan Joint Graduate Program in Communication and Culture. His research includes humor studies, political economy of media, and cultural studies. He has been a research assistant for the last 5 years and is working on a project entitled Developing a Comprehensive Understanding of Elder Abuse Prevention in Immigration Communities. And Keefer Wong. Keefer is a PhD student in sociology in the sociology department at York University. As a graduate associate at York Center for Asian Research, his research intersects globalization, political sociology, knowledge production from Canada, China, and Hong Kong. He has presented in international conferences and published in academic and government reports. We are honored to have our three speakers today, and I now hand it over to Guida to begin. Thank you so much.
Thank you so much, Mary, for the introduction, and I really appreciate it. And before I begin, I would like to extend my sincerest thank you to the conference organizers, particularly Ray and Rideout, for inviting our team to present our research findings to you. So our paper today is entitled Perspectives of Cantonese-speaking older immigrants in Toronto on elder abuse risk factors. So this is the order of our presentation. First, I will give you an introduction and describe our research methods, and then we will talk about the quantitative and then the qualitative data analysis, and finally we will conclude. Okay, so previous studies have found that 4.5%. Okay, I'm sorry, the slides are a little bit okay, out of order. There you go. Okay, so previous studies have found that 4.5% of Chinese elders aged 65 years of age and older in Canada experience abuse. However, elder abuse within the Chinese community is underreported and underestimated due to a range of reasons, including stigma and shame. Since filial piety remains a cherished value amongst many Chinese elders, so many of them do not want to admit or are reluctant to report any abuse from their family members for fear of losing face. Also, Chinese elders are not well represented amongst users of long-term care facilities or home care. So that affects the reporting of neglect and abuse as well. Previous studies have also found that financial dependency, physical dependency, and emotional dependency, they are risk factors for abuse for Chinese elders. To date, there is limited research on elder abuse in the Chinese immigrant communities, especially in the Cantonese speaking community. So our study will fill this gap in this area. In terms of our, I'm having, okay, there you go. So in terms of our research methods, our study draws on an intersectionality lens and an ecosystemic framework. An intersectionality lens highlights the complexity surrounding social identities such as race, class, gender, age, and how they converge at different levels to produce privileges, power, vulnerability, and inequalities. An ecosystemic framework views interpersonal violence as the outcome of interaction among many factors at the individual, the relationship, the community, and the societal levels. So our paper focuses specifically on the Cantonese speaking community as part of a larger study, which is which examines the elder abuse risk factors with 2 recent and 2 long-term immigrant communities in the GTA. The 2 recent communities are the Korean and the Tamil communities, and the 2 long-term communities are the Chinese and the Punjabi communities. The objective of our study is to examine participants' perceptions of the risk factors identified by previous research as being important. As well, we want to explore new risk factors unique to the Cantonese speaking community. The study design is a mixed methods approach. We use both quantitative and qualitative research approaches. And the setting is in the Greater Toronto area. We use several strategies to recruit community participants. First of all, our community partners, Hong Center for Geriatric Care and the Center for Immigrant and Community Services, they help us advertise the study to their clients. And secondly, we utilize our existing network of personal and community contacts. And lastly, we use snowball sampling approach to do our recruitment. In regard to the data collection, we conducted 6 group interviews in total. Each group consisted of 6 to 8 participants. So in order to make sure that participants felt comfortable during the research, we organized separate groups by gender. So 3 groups of older women and 3 groups of older men. So all the group interviews were conducted in Cantonese by bilingual and bicultural research assistants. We examined 13 risk factors identified from existing literature, and these are advanced age, gender, length of time in Canada, sponsorship status, lack of English knowledge, income, employment, physical dependence, emotional dependence, financial dependence, multi-generational co-residence, social isolation, and racialized status. So at the focus group session, participants first ranked these risk factors on a questionnaire on a 0 to 4 scale, like this one here. And so that is the never, so those scales are never, rarely, sometimes, often, and very. So with never being, 0 and very being 4. So based on how frequent and how important the participants perceive these risk factors are, and whether they lead to elder abuse in their community. So this is how they rank them. So the participants then engaged in a group discussion to further examine why they perceive certain risk factors as being more prevalent or more significant, as well as we want to explore possible additional risk factors identified by the participant. They are not, it's important to know that the participants were not asked to talk about their own experience with abuse. Okay, so we don't want them to feel stigmatized. Rather, they were reminded to only share their perceptions of abuse. For our data analysis, we use SPSS to analyze our quantitative data, and in vivo we use in vivo qualitative data software to use for our data analysis for the qualitative data. So I will stop here, and I will let Ernest, pass on to Ernest to talk about the quantitative data analysis as well as some qualitative data analysis. And then he will be followed by Keefer, who will talk about the rest of the qualitative data analysis. So there you go. Okay.
Thank you, Guida. I'll now first talk about our participants' demographic characteristics. So this table details the social demographic characteristics of our study participants. In total, we recruited 20 older women and 21 older men. Among the 20 older women, 9 of them were between 60 to 64 years old. 9 were between 65 and 75, and 2 of them were above 75 years old. 14 participants were married, 2 were single, 2 were widowed, and the remaining 2 were divorced. 17 participants reported having children. As for years of arrival, 4 of the older women arrived before 1980, 4 arrived between 1981 and 1999, and the remaining 12 arrived between 1991 and 1999. 6 of them were sponsored by their family members. 4 were dependent on skilled worker. 4 arrived through the Canadian Immigrants Investor Program. So you can see that they are the immigrant investor here in the table. And then 3 were skilled workers themselves. 2 arrived in Canada through family reunification. And the remaining 1 was an international student. At the time of the study, 14 older women were Canadian citizens, and the remaining 6 were permanent residents. As for level of education, 8 older women completed post-secondary education. Sorry, Guida, could you please go back to the last slide?
Okay.
Thank you.
Sorry about that. There's having problem with the yeah. Anyway, go ahead, please.
So I was saying 8 older women completed post-secondary education, 4 completed high school, 5 completed some high school, and 3 completed primary school. In terms of sources of income, 5 older women reported earning wages or salaries. 4 had personal or family savings. 2 were receiving income from self-employment. 9 had OAS. 8 had a Canadian pension. And 4 had personal investments. 3 older women reported having no personal income. As for proficiency in English, 13 of them reported a somewhat proficiency. 4 reported an excellent proficiency. 12 reported a very good proficiency. And then 1 reported a poor proficiency in English. As for the 21 older men, 4 of them were between 61 to 63 years old. 14 were between 65 and 75, and 3 of them were about 75 years old. 18 of them were married, 2 were single, and 1 was divorced. 20 participants reported having children. As for year of arrival, 7 of the older men arrived before 1980. 6 arrived between 1981 and 1990, and the remaining 8 arrived between 1991 and 1999. 8 of them came to Canada as skilled workers. 4 were sponsored by their family members. 4 were international students. 3 came through the Canadian Immigrants Investor Program. 1 was a temporary foreign worker, and the remaining 1 came to Canada through the Startup Visa Program. At the time of the study, 20 older men were Canadian citizens, and the remaining 1 was permanent residents. As for level of education, 13 older men completed post-secondary education, 6 completed high school, and 2 completed some high school. In terms of sources of income, 1 older man reported earning wages or salaries. 17 had OAS, 20 had Canadian pension, 9 has pension from other countries, 12 had personal or family savings, 10 had personal investments. As for proficiency in English, 4 older men reported excellent proficiency, 11 reported a very good proficiency, and 6 reported a somewhat proficiency. Let us now turn to talk about the quantitative rating of the risk factors. So as Guida mentioned in our earlier in the method session, participants rated the 13 risk factors based on their perceived frequency and importance in the Cantonese speaking community. Risk factors with a mean rating score higher than 2 were classified as very frequent or important. Some gender-based differences were also significant, statistically significant if the p-value is lower than 0.05 and the Cohen's d value is larger than 0.6. So this table 2, details the participants' rating of the risk factors based on the perceived frequency of occurrence in the Cantonese speaking community. Participants identified in descending order: financial dependence, physical dependence on others, emotional dependence, social isolation, and lack of English as the most frequent risk factors that lead to elder abuse in the Cantonese speaking community. Some statistically significant gender-based differences were also found. Older women tended to identify physical dependence and financial dependence as highly frequent risk factors, while older men perceived them as moderately frequent risk factors. This gender-based difference appears to correspond to how our society is socially organized. Gender ideology and structural imperatives channel women, particularly those with young children, into low-pay, precarious position, while men, particularly immigrant men, are increasingly being precaritized. They still fare better than immigrant women. Hence, older women are less likely to be financially independent vis-a-vis their male counterparts. Since financial independence is linked to physical dependence, older women are therefore also prone to be physically dependent on their caregivers. Furthermore, the older men in that study are more likely to have received post-secondary education. For instance, 19 out of 21 older men received post-secondary education, compared to only 8 out of 20 older women. As such, older men likely have had more stable employment in the past compared to older women, which provided them with a more comfortable financial situation. This is evidenced by the number of participants who were receiving pension. 20 older men had Canadian pension, whereas only 8 older women had a Canadian pension, showing that only older men were more likely to have worked in Canada before retirement. In contrast, older women are less likely to be financially independent. As demonstrated by the social demographic data, 3 older women reported no personal income, whereas all older men had at least one source of income. Furthermore, only 9 older women reported receiving the OAS, whereas 17 older men had OAS. They are also more likely to have arrived in Canada as a dependent on the family members. In fact, 10 older women came to Canada as a dependent on their family members, compared to only 4 older men. Therefore, older women are more likely to be dependent on others to pay for medical services or provide transportation. The differential experiences with employment due to level of education may make older women perceive financial dependence and physical dependence on others as more significant risk factors of elder abuse. Thank you, Guida. And for table 3, it details the participants' rating.
Oh my goodness. I'm so sorry.
Oh, that's okay. Yes, thank you. So table 3 shows the participants' rating of the risk factors based on their perceived importance. Similar to table 2, participants identified in descending order physical dependence on others, financial dependence, emotional dependence on caregivers, and social isolation as important risk factors. Additionally, lack of English is also identified as an important risk factor. Interestingly, older women tended to rate gender, length of stay in Canada, and emotional dependence on caregivers as important risk factors, whereas older men tended to view these risk factors as low to moderately important. The differential rating of this risk factor, length of stay in Canada, may also relate to financial independence. In our sample, only 8 out of 20 older women arrived in Canada in 1990 or before, compared to 15 out of 21 older men. As discussed in previous research, length of residency in Canada necessarily influences the number of years an immigrant can partake in the Canadian labor market, as well as their eligibility for government pension benefits. For example, the Canadian government provides the OH security, so the OAS, to older adults who are age 65 or older and have lived in Canada for 10 or more years. As a result, the older women in our sample may perceive length of stay in Canada as a more significant risk factor. In terms of gender and emotional dependence, historically, Chinese women are less likely to receive education and partake in the labor force, which could have helped reduce the emotional dependence on their family members. This trend is observable in our social demographics data. A total of 19 older men received post-secondary education, and only 8 older women had the same level of education. This shows that older men were more likely to have participated in the labor force. Consequently, older women are less likely to be are more likely to be a dependent on their family members. This historical factor may explain why older women in our study have perceived gender and emotional dependence as more significant risk factors than men. I'll now turn to the qualitative data to talk about the risk factors, especially the interrelatedness among them. So let us start with the most frequent risk factors, which is financial dependence. So many older immigrants have voiced that elder abuse often takes place among those with no personal income. According to one older woman, she said here on the top, when you are a senior over 60 years old, of course, it is harder to find a job. It is very lucky if someone still hires you when you are in your 60s. But you also need to know yourself, know your own physical well-being. If you don't work, however, you may be discriminated against at home or in the community. So in a lot of situations, being able to earn money can make you stand on equal ground with others. As this older woman was a Canadian citizen in her early 60s who moved to Canada in the late 1990s. She has completed a bachelor's degree and was divorced with children. She reported a somewhat proficiency in English. She was living with her son and reported no personal income nor support from the family. In her view, employment and financial self-sufficiency is of paramount importance to an older immigrant's well-being. In contrast, when older adults have financial independence, they can easily access the necessary care and avoid abusive situations from happening. As one older male participant explained, financial reliance is the most important factor. If you have a lot of money, your children will come back to see you very often. What I want to point out is that money cannot solve all problems, but you cannot do anything without money. You can solve a lot of problems with money. You need people to take care of you. You can hire 3 or 4 people to do that. If you want someone to accompany you, people will come see you. You can have a small party every day and a big party every week. Money can solve a lot of physical problems. For language-related issues, if you have money, you can hire a secretary. You won't have any inconvenience in life because there are someone working for you. This older man in his late 60s was a permanent resident who came to Canada in the late 1970s as a skilled worker. He was married with children and completed a college degree. He was living with his spouse and reported very good proficiency in English. He reported his sources of income include the OAS, Canadian pension, and personal/family savings. Sorry, Guida, one more slide before.
I am so sorry.
No worries, Guida, take your time. If not, maybe if you'd like me to download the deck, or I think you just need to click on the last slide.
Yeah, I think this, okay, there, hopefully this is, okay. Because I think it went back to here.
Okay.
No. Okay, so I am really sorry.
That's okay.
It's not advancing when I hit return. So
No worries. I can share my screen and bring up the deck if that's helpful.
okay. So maybe I should quit and reload it again. Should I do that?
Yeah, if you want to quit, and then would you like me to share?
I'm going to share it. Okay, there you go. Okay. So that's it. So now it's back to here.
Maybe on the left side, you can scroll up. Can you scroll up a little
yes,
bit?
Yeah, which
and then click on financial dependence.
One more before.
One more, yeah. And then click and then make it,
yeah, maybe we do it this way because I'm having problem with the mouse. So we'll just do it this way. Is it okay? Can you see the screen this way as well?
Yeah.
Yeah, we can see it, and our panelists,
Yeah,
our
I don't have
viewers.
to click. Yeah, this way I don't have to. I won't have problem with the mouse.
This is great. Go ahead, please. No worries. Everything is perfect. It's all good. Go ahead.
Ernest, go. Please continue.
Sounds good. So we're just at the quote below. just to recap, this older man was in his late 60s and he was a permanent resident. He came to Canada in the late 1970s as a skilled worker. He was married with children and completed a college degree. His sources of income include OAS, a Canadian pension, and personal/family savings. According to him, financial independence allows older adults to pay and obtain whatever care and services necessary for their well-being. For example, older adults can hire a person to help translate any language-related problems. Furthermore, instead of going to social events in the community, older adults with financial self-sufficiency can organize events at a location convenient to them, thus reducing the need to rely on others for transportation. I'll now pass it on to Keefer to talk about the remainder of the risk factors.
Okay. Are we on the right screen? Okay, perfect. Thank you, Ernest. Okay, so as Ernest mentioned, another risk factor that could lead to elder abuse is physical dependence. A recurring problem identified by both older women and men is their physical dependence on others. Specifically, the participants often mention how physical dependence limits what older immigrants can do as they get older and must rely on others for their physical needs. Here then, according to some participants, the impact of physical dependence is much larger among people who are older in age. As one older woman points out, quote, when you are in your 70s or 80s, everything starts to deteriorate, your health and other things. Once they start to deteriorate, if your English or finances are still okay, then everything is fine. But if both of these aspects are not okay, and you have to rely on the younger generation to take care of you, then your well-being will go downhill. If the younger generation is not considerate, then the older adult will get hurt. If they have a good attitude, then they can go seek help like CICS, Hong Fuk, but if they choose to not disclose anything to other people, then they may suffer. So age is important. At the beginning, when people first came to Canada, everyone is strong. They can live 20 to 30 years without any issues. But with age, they slowly become the ones who need to be taken care of, end quote. This older woman was in her late 70s, widowed, and had children. She came to Canada in the early 1980s as an immigrant and is now a Canadian citizen, holding a bachelor's degree while receiving OAS and a Canadian pension. She reported being somewhat proficient in English. However, like she mentioned, physical illnesses are something beyond her control, and people inevitably experience physical illnesses when they grow older. As she stressed, when one gets older, your physical well-being becomes much more important. Faced with this physical dependence and its financial pressure, they become reluctant to go out to community agencies and services if their family members cannot provide transportation. Consequently, older immigrants can lose access to their established connections with friends. This physical dependence, and in turn, lack of social connection, makes older adults more vulnerable to isolation and can impact their well-being. As this older woman points out, in connection with other risk factors, being financially independent while being able to speak English can allow older immigrants to travel to community agencies and seek services without being too physically dependent on others. But as she points out, when this is not the case, some older adults may choose not to disclose anything to other people due to the shame and stigma of such dependency and for fear of losing face, as filial piety, as we mentioned before, remains of utmost importance among many Chinese elders. Some of our study participants expanded on how the significance of physical dependence might lead to social isolation and elder abuse in the Cantonese-speaking community. One older man jokingly said that nowadays, quote, nowadays, a lot of the younger generations like to move very far away from the city to the north. If you move there, and if the older adults don't drive you, you can't find anyone to talk to. If you walk on the street in the rural side of Canada, even if you have a machine gun, you're not going to hurt anybody with it. You just sit at home the whole day and it is boring, end quote. This older man in his late 60s is a permanent resident and married with children. He arrived in the early 1990s as an international student. He holds a master's degree, reports being somewhat proficient in English, and lives with his spouse. His sources of income include the OAS, Canadian pension, personal family savings, and personal investments. As he observes, physical dependence on caregivers can sometimes lead to social isolation and is a serious problem in rural Canada due to the fact that the Canadian population is spread far apart. For older immigrants with no access to public transportation in the rural area, connecting with people of similar background or interest is almost impossible. As a result, these immigrants are unable to leave their homes and they are increasingly isolated. Their well-being could be negatively impacted and they may become vulnerable to elder abuse. Okay, now moving on to the next slide. This is the third risk factor, emotional dependence on caregivers. So according to the participants, older adults often display significant trust for their caregivers. However, these feelings and emotional dependence on caregivers could result in their vulnerability for being exploited for their labor or finances and ultimately elder abuse. As the following older man explained, some older adults blindly trust their caregivers, making them vulnerable to abuse and exploitations. Quote, "This problem with emotion, it really is true. I have a friend, an older adult whose son is their only family member. The person really relies on their son. Their son is like the whole world to them. But it turns out the son abuses the person. He said something like, 'I help you with everything.' And then he took all the money away. The person has to rely on the son, so they thought they could trust and pay the son. They trusted him because he was the only relative," end quote. This older man is in his early 70s and is married with children. He arrived in Canada in the mid-1960s as an international student and has since become a Canadian citizen. He had a master's degree and reported an excellent proficiency of English. At the time, he was living with his spouse. He reported OAS, Canadian pension, pension from his home country, personal investments, and personal family savings as sources of income. Due to the established emotional and trusting relationship and a reluctance to report any abuse from family members for fears of losing face, older immigrants, like the one mentioned by this older man, are less likely to question their caregivers and realize that their caregivers are abusive. As this older man points out, an emotional dependency with their caregivers can sometimes lead to different exploitations, and in this case, financial exploitations or abuse. Nevertheless, some participants stress that older adults should respect the boundary between them and their caregivers. Older adults should ensure their emotional needs do not cause disruptions to their caregivers' lives. As one older man had said, quote, "A lot of the younger generation may not be able to arrange to have a meal with you every week. They have their own friends. In such cases, it's not that they don't care about you emotionally or they are trying to neglect you. It's just that everyone is fighting for themselves in society. So we all need to be understanding," end quote. This older man in his early 70s has completed high school and was married and had children. He arrived in Canada in the late 1980s as a sponsored parent-grandparent. He was a Canadian citizen and reported a very good proficiency of English. At the time of the study, he was living with his spouse. His sources of income were OAS and Canadian pension. As he observes, if the older immigrant's emotional needs become disruptive of the caregiver's own livelihood, this situation can result in hurtful feelings and potentially lead to emotional abuse. Okay, now on to the fourth risk factor. Social isolation has been recognized as one of the most significant predictors of elder abuse. As mentioned already, and to reiterate, these risk factors are not mutually exclusive and can sometimes manifest simultaneously or concurrently with each other. This was seen in the earlier example when a physical dependence and its separation of the older adult into the suburbs led to a social isolation. Although this was a risk factor where social isolation was attributed to a specific caregiver, social isolation can also increase the risk of elder abuse in institutional settings. One older woman said that even in nursing homes, quote, "Even in nursing homes, if the family members go visit the older adults often, the workers will not dare to hurt the older people. If no one visits you in 9 years, even if the workers hit you or pinch you, you cannot complain. If you complain, they will keep ignoring you, like refusing to lift you up from your bed. How likely are you going to complain? Are you going to sue them? Will they ever compensate you for hurting you? End quote. This older woman in her early 60s who was married with children was a Canadian citizen who came to Canada in the late 90s through family reunification. She completed elementary school and reported being somewhat proficient in English. She was living with her spouse and reported her salary as a source of income. As she observes, socially isolated older adults are likely targets of neglect or even physical abuse in elderly care institutions. The reason is that the staff knows these older adults have no way to escape from abuse. In other words, social isolation forces older adults to endure elder abuse in institutional settings as they have no way to leave abusive situations. As a result, it intensifies the social isolation of older adults as they have no one to take care of them or to talk to. Social isolation is sometimes more serious among older immigrants with low media literacy. According to the same older woman mentioned, quote, "I also know a person who cannot go back to their home country. The person stopped joining activities at the church. Then the person feels like they have been cut off from society. For us, we can do everything through a message on apps like WhatsApp or WeChat. But this person doesn't know how to use smartphones. Even phone calls, they don't know how to do that. They still need to use keyboards. So no doubt they will feel lonely," end quote. As she points out, social connectedness among older immigrants is increasingly mediatized. However, for those with low media literacy, they have a more difficult time staying connected with other older immigrants. The impact of social isolation is thus far greater on older immigrants who have low media literacy and do not know how to use new technology such as smartphones or tablets. And the last risk factor, the lack of English knowledge. According to the participants, a lack of English knowledge could lead to elder abuse. Okay, thanks. Elder abuse due to older adults' lack of access to resources provided by the government to improve their living conditions. According to one older male, quote, "If you don't have enough money, the government would subsidize you. There is subsidy for you to apply. Of course, it doesn't give you a very high standard of living, but do you know how to apply? It is us Chinese people who don't know how to apply. It is mostly because our English is not good enough. Westerners apply for a lot of benefits, and the government provides to them," end quote. This older man was in his late 60s and was married with children. He arrived in the late 1980s as a skilled worker. He acquired his Canadian citizenship and was living with his spouse. He completed high school and received sources of income, including OAS, Canadian pension, and pension from his home country. He reported being somewhat proficient in English. Apart from the OAS, Canadians with low incomes who already received the OAS can apply for the Guaranteed Income Supplement. These resources can help older adults experiencing elder abuse to leave their abusers. However, for many older immigrants who are not proficient in English, these social resources are beyond their reach. Furthermore, some participants suggested that a lack of English knowledge can trap older adults in abusive situations as they cannot find help. According to one older woman who was in her mid-60s and reported an excellent proficiency in English, quote, "If one does not know English, one does not know how to communicate with other people. When there is a crisis, they can't communicate with other people, with those who can solve your problem. If older immigrants do not have a good grasp of English, even if they have the best consultant or lawyer or accountant, they can still be abused. Lawyers can also abuse them. Developing an independent knowing of things is very important. In Canada, the means of communication, the means of knowing, it's mostly through English," end quote. This older woman was a Canadian citizen who was married with children. She came to Canada in the mid-1970s as an international student. She completed her bachelor's degree and certified financial planner qualification. She was living with her son and reported her salary from paid work as a source of income. According to the participant, older immigrants who do not have a good knowledge of English would also be unfamiliar with the systems in Canada and can easily become a target of elder abuse by the very same professionals hired by them to protect their legal or financial matters. Although there are programs to help immigrants improve their level of English, some participants in our study has mentioned that participation in the labor markets is the best way to improve one's proficiency in English. According to one older man who explained how a low proficiency in English limits immigrants' career choices, quote, "They do work, but they all work for Chinese people only. If you work for Chinese people, you get the lowest wage, yet the longest work hours. So it is hard to improve your livelihood. If you don't know English, there is no way. If you go to other workplaces, you need to know the culture. If you go to workplaces other than Chinese workplaces, you need to learn something new," end quote. At the end, this older man was in his late 70s and was married with children. He arrived in Canada in the mid-1990s through a startup visa. He was a Canadian citizen and he completed high school. He reported a very good proficiency in English. He was living with his spouse, son, and daughter. His sources of income included OAS, Canadian pension, and personal family savings. As observed by this individual, structurally, the mainstream labor market excludes immigrants with low English proficiency. As a result, immigrants with limited English proficiency are relegated to employment in the ethnic enclave, further marginalizing the opportunities in the labor market. It is not surprising then when language and cultural barriers are one of the main factors for why elder abuse continues and why victims of elder abuse are reluctant to report such instances. And now I'll hand it over to Guida to conclude our presentation. Guida,
Is Mary here? Mary, how much more time do we have?
Yeah, we're just okay. We're a little over time, but I know our participants are enjoying this. So if we could just maybe wrap up and get to one or two questions, that would be wonderful.
Okay, so I would quickly conclude. So, well, it's evident that, our study found that financial dependence is the most important risk factor, and it intersects with other risk factors to produce vulnerability to elder abuse. So we therefore recommend policy changes which would benefit older immigrants financially. And so that include making OAS more available to immigrants and shortening the length of sponsorship for seniors because currently it's 20 years, right? So shortening the length of sponsorship so that we enable older immigrants to become financially independent by allowing them to receive OAS and also guaranteed income supplements, and providing free or further reduced cost of public transportation for seniors. It's also very important in reducing their social isolation, which is a key factor for elder abuse. We also recommend providing caregiving assistance and financial assistance to family members who are caregivers, and so that we can support aging in place. As well, interventions to assess and address older immigrants' financial needs, physical dependence, and potential exposure to elder abuse risk factors are key strategies to prevent elder abuse. And lastly, I would like to acknowledge that the study developing a comprehensive understanding of elder abuse prevention in immigrant community was funded by a SSHRC Insight grant to Sepali Guruge as the principal investigator, and Souraya, Sidani, myself, Guida, and Esko Matsuko as co-investigators. And I would also like to extend a huge thank you to all the older women and men for their participation in our study. And we thank our community partners, Yihong Center for Geriatric Care and Center for Immigrant and Community Services, for assisting us with the project. Thank you so much. And I will stop here.
Thank you, Guida, Ernest, and Keefer. We've had so many wonderful comments in the chat box about all your research and findings and presenting this in such an easy and informative way to understand. So thank you on behalf of all our participants viewing and on behalf of Elder Abuse Prevention Ontario. A quick question that came through was there an immigration status requirement to be able to participate in the study?
Not really. So as you can see in the quantitative data analysis and the profile of the immigrants, they came in at different stages, and you know, like before 1980s and 80 to 90, 91 to, you know, and so on. So they came in at different stages, but just the fact that they have immigrated to Canada from another country. So that's the only criteria.
Excellent. Thank you so much. And again, thank you today for your time, your expertise, your wisdom, and for the continued work we know you're continuing to do in the community. So thank you so much. And we look forward to having you back again to present with Elder Abuse Prevention Ontario.
Thank you so much for the opportunity to present here today. And we hope that, you know, the audience will have something to take away today. Thank you.
I'm sure they did. Thank you, everybody. Thank you. We'll see you again real soon. Take care.
Thank you.
you.
Bye.
Thank you.
Bye.